Yo guys, welcome to our video today. So it's really a good evening here in Africa, and today we are going to talk about a very important topic also in our medical perspective. And today we are going to talk about something which is very sensitive in our lives. And if you have not really watched our previous videos, here is where we get to talk matters medical, but we put it in a very simple language in which we can all easily understand. Kindly guys, if you have not subscribed to our channel, I want to welcome you to subscribe to our channel and also get to subscribe and also get that support to us, because that is the best way in which you can get to really boost this channel. The channel is Future Talks, and my name is Vincent. We get to share a lot in this channel. Watch our previous videos so that you get to understand what we really do in this channel. So I don't know if you know the difference between the STI, sexually transmitted infections, vis-a-vis the urinary tract infection. We're going to look at the signs and symptoms of urinary tract infections. We're going to look at the treatment we use in the treatment in the urinary tract infection, and also differentiate the urinary tract infection vis-a-vis the sexually transmitted infection or sexually transmitted diseases, that is the STIs or the UTIs. So let me know if you have had that experience of getting especially the urinary tract infection, what can really bring it, what you did right or wrong where you got to get infected with this the UTI thing. So kindly give that comment so that we get to share how best we can go, or how best you went about it, because we need to know what you did and how you managed it at the end of the day to get the best results out of it. Guys, welcome to our video. You guys, welcome to our video. We are talking about the urinary tract infection, and this most of the time happens with bacterial infection. So and they affect especially for these bacteria come from the urethra or the rectum, so that they end at actually these bacteria is often from the skin, come from the rectum also, and to enter the urethra. And the urethra is the pipe which gets the urine out of the bladder, so that that infection now, when it gets to the urethra, it causes an infection, and this can affect most parts of our system, of our urinary system. And sometimes this urinary tract can affect the bladder or bring about the bladder infection, or what we call cystitis at the end of the day. And sometimes they can affect the kidney, and when that infection affects the kidney, we get to call that one pyelonephritis. Pyelonephritis. So that is the infection of the kidney. And especially the pyelonephritis is not very common, but it is the most lethal part of the urinary tract infection, because now it has gone above the bladder and gone to the kidneys. So what are the risk factors what are the risk factors which can predispose you to urinary tract infections? So some people are at high risk of UTI more than others, and the most common explanation given, especially the most affected population is the female, and that is very that's common from the way the structure of the urinary system of a female is made. You get that the urinary tract is very short compared to the male, so the infection is likely to go very easily. And since because of the shortness of the urethra, and because it is closer to the rectum, this makes it easier for the bacteria to move from the rectum area, so to enter into the urinary tract infection most of the time. So those are the kind of explanation given why female get more affected by the urinary tract infection more than the male. So other risk factors may include also previous UTI. If you have had a previous UTI, you are also at risk to get another one. Sexual activity can also predispose you to that, especially those who involve themselves in anal sex. When you get to introduce that to the birth canal, get that one can also predispose you to it. Changes in bacteria that live in the vagina or the vaginal flora. For example, during menopause is a predisposing factor for that. You get that predisposed to such kind of infection. So menopause can be a predisposing factor. Also, use of what you call spermicide are special drugs which get to kill sperms, and they're used as a means of family planning so that the lady doesn't get pregnant, because they change the normal bacteria and they kill the normal bacteria of the vagina. So you get one is predisposed to such kind of infection. Age, older adults and young children are more likely to get the UTIs because of the aspect of hygiene. When you get older, your hygienic levels are really affected, and you're not likely to do it very well when you're old. And also for kids, especially depending on who is doing the hygiene, especially the young girls, they're likely to develop this kind of infections because of the way they are not able to take care of their private parts very well. That's very important, that we take good care or hygiene of the private parts of our kids, and also teach them what to do and what not to do with their private parts, and how to clean them and maintain them at some point. Poor hygiene, for example, children who are potty training. So we should really train our kids on how to do proper hygiene, because potty training, we have special containers for kids to pee and also gets to poop there. So how we train them also is very important, so that we avoid them on getting such kind of infections. So what are the signs and symptoms of urinary tract infections? Number one is about pain or burning while urinating. Number two is frequent urination. Number three is about feeling the need to urinate despite having an empty bladder. You always have that urge to urinate. So that's one of the signs of this UTI or urinary tract infection. Another sign and sign which can be there, we have blood in urine. So most of the time when you take a sample of that urine and you go to the lab and get to study it, sometimes because of the infection you get that there's blood in urine. And also we have pressure or clamping, all the cramping. Those people have some sensation which is very hard on the groin there. So we have some cramping, and also on the groin or the lower abdomen. So when we go, because when we have what we call pyelonephritis or the infection of the kidney, we may develop fever, chills, lower back pain, or in the side of the back. Also, at some point, nausea and vomiting may be involved at some point. So younger children may not be able to tell you about UTI symptoms, they are having, while fever is the most common sign of UTI in infants and toddlers. So most children with fever do not most children with fever do not have the UTI, but if you have concern that your child has UTI, talk to your healthcare provider about the same. So I've talked about the urinary tract being very short, being the most thing that can be predisposing you to the infection of the urinary tract infection. So on treatments, your doctor will ask you about what you are feeling. We do a physical exam, do a urine tests. Most of the time we do urinalysis here in Africa. That's what most of the time is done. So bacteria cause of the UTI is determined, and you're given the antimicrobial drugs to react on the what has caused that particular problem. So depending on which bacteria is causing it, so you will really get the approach and also get treated. Because of I've talked about recurrent UTI or recurrent reinfection of of the same. So the patient may or you may have frequent UTI depending on the bacteria causing. That's why now bacteria determination is done, so that you get the proper drugs which can kill that particular infection. So because most of the infections are caused by bacteria, so the advice which you should take as a patient is that take antibiotics exactly as your healthcare professional tells you, and the worst of it, do not share antibiotics with others, and do not save antibiotics for later use. So talk to your healthcare provider on discarding if there is remains of those antibiotics. And most important practice, which is ancient, is about drinking plenty of water or other fluids. So and also maybe your healthcare provider, because of the pain, may also prescribe other means, which other painkillers, which may help you to have the best experience. How can you prevent urinary tract infection? Number one, urinate after sexual activity. Stay hydrated, that is taking a lot of water. Stay well hydrated. Take shower instead of baths. Taking showers instead of baths is very important, that is if possible. Minimize douching, sprays or powders in the genital area. And teach girls when pot training to wipe front to back. It's a good practice that when you wipe down there, you train your girls, especially to do from front to the back, so that you don't introduce the bacteria from the anal area to the vaginal area, which might predispose that young girl to the problems of infection. So UTI is a very common thing, and it affects most of the people at some point, but it's easy to manage, but also very difficult when it comes to antimicrobial resistance. It can be very painful and also very uncomfortable for the one experiencing it, but it can be easily controlled when it has not gone to the bladder, when it has not gone to the kidneys, so that we get to get that comfort. Guys, I want to welcome you to our channel, the channel Researcher Talks, and kindly, if you have not subscribed, I want you to subscribe, and I want to welcome you to our next videos. Welcome, guys. Thank you very much.